afternoon, everyone, and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, New South Wales Multicultural Health Communication Service, and Multicultural New South Wales. Today, we will have the Minister for Multiculturalism, Mark Coure, and a New South Wales Senior Medical Advisor, Dr. Jan Fizzell, to give you updates on COVID-19 and answer any of the questions that you may have. So please put them on the chat. Before we start, we'd like to please first acknowledge the traditional owners of the land from which we are all meeting today. For us here with Dr. Jan, we acknowledge the traditional custodians of the land, the Camaragal people of the Baringa tribe of the Eora Nation. We also acknowledge and address those people who are from multicultural communities who are joining us today. So as we have only 30 minutes, you know the drill. Please put your questions on the chat and please keep your microphones on mute so that we can make sure that we have the questions answered. So let's start. Minister Coure, it's nice to see you again.
Well, good afternoon. Thank you very much for joining us today, and thank you to everyone who's on this Zoom. We're of course doing this on a weekly basis, and it's important that we get to as many of you as possible with the latest information out there from the government that's been recently announced. So today, of course, I'd like to start by acknowledging the traditional owners of the lands in which we meet today, and the custodians of the lands in which we meet today, and our elders past, present, and emerging. I want to thank again the media outlets for attending and for their support during COVID-19, and of course during the Delta outbreak as well. And of course, as governments are announcing the latest information, and New South Wales Health is announcing the latest health advice, that it's important that that information is out there in the community, particularly our multicultural communities, as quickly as possible. Look, a couple of points today very quickly. Key messages from the government, and that is, of course, the booster shot. And it's important that we increase our rates of the booster shot as quickly as possible. The Premier, Minister Hazzard, Minister Dominello, and myself recently announced this on Sunday, and that is, of course, a statewide advertising campaign to ramp up the booster vaccination shots. And it's continuing with the Let's Do This campaign, but extending to our boosters this time. And that information was announced on Sunday. It will include ads in 19 different languages and expected to reach over 1.4 million people right across New South Wales, culturally and linguistically diverse residents. Really important, and that is so that everyone gets the booster message. Really, really important, particularly our communities on this Zoom, no matter their language or cultural background. In addition to that, of course, we've seen over the last few weeks all of our announcements translated in many different languages, and of course that's been really well received as well. The take-up rate through councils, through our multicultural media, through our multicultural community groups, really, really important that those messages keep going out there. And we're using our councils, our multicultural media, you guys, our stakeholders, to get that information out into the community as quickly as possible for you and your community. We want to make sure that everyone in New South Wales follows their health advice, stays healthy, stays safe, and of course, more importantly, when it is that time, get that booster shot as quickly as possible. And before I throw it out to New South Wales Health or Multicultural New South Wales, I do want to, of course, acknowledge Catherine Davies here from Multicultural New South Wales, and of course our representatives from New South Wales Health as well. Very quickly, just in terms of rapid antigen testing for vulnerable groups, we're continuing with this rollout. 42,000 rapid antigen test kits have been distributed to multicultural communities. And in fact, by the end of the week, they would have had 42,000 distributed to multicultural communities. We aim to see more than 100,000 distributed by the end of February in total. And we want to make sure that the supply is sustained and into our community groups as quickly as possible. You would have seen announcements from the government. We welcome the news that our international borders will be reopened, and almost 2 years after the nation's borders were closed to the world during this pandemic, we will see the international borders open, which is great news for loved ones who are coming in or going out and of course, great for jobs as well and for the economy. And more importantly, it's great for multicultural communities who can visit their overseas family members or their families visit them, as I said before. So important points about the rules still in place. If I can just quickly cover these, and then we'll throw it back to New South Wales Health, or any questions for that matter. All foreign visitors in Australia will have to provide proof that they have received the full course, I should say, of an approved COVID-19 vaccine. Unvaccinated travellers will still need to apply for a travel exemption to travel and to come to Australia and undergo hotel quarantine if they were granted permission to enter the country. And the New South Wales Government caps on quarantine for unvaccinated travellers will continue to apply. So I might throw it back to New South Wales Health and then open it up for any questions.
Thank you so much, Minister Coure. And it's so wonderful to see that the rapid antigen tests have been distributed to multicultural communities, and we've been seeing that across a lot of media. So thank you to the multicultural media who's been sharing those news to your communities. And now we pass on to Dr. Jan for some updates. Dr. Jan, how are you?
Well, thank you, Jess. So today we have 95% of people aged 16 or over who've received a first dose of a COVID vaccine, and 94.1% have received 2 doses of the COVID vaccine. Importantly, though, of people over 16, 44.8% have now received a 3rd dose, but it's only 49% of the people who could have had that 3rd dose. So it's really important that we get people caught up and getting that 3rd dose. Of children aged 12 to 15, just over 83% have received a first dose of a COVID vaccine, and 78.7% of them have had a 2nd dose. And really importantly and excitedly, our kids are getting vaccinated. The littlest, well, some of the littlest ones of our children aged 5 to 11, 43.6% have had a first dose of a COVID vaccine. The total number of vaccines administered by New South Wales Health is over 16 million, with 4.8 million doses administered by New South Wales Health to 8 p.m. last night, and over 11 million administered by the GP and pharmacy network. So really great take up, but we've still got a way to go to catch people up on that 3rd dose. And of course, people can still find a good place to get vaccinated for them using the New South Wales Health Vaccination Clinic Finder. Sadly, though, we're reporting the deaths of 20 people with COVID-19 today, 11 men and 9 women. And we express our sincere condolences to those people's loved ones. And that brings the total number of COVID-19 related deaths through our pandemic to 1,618. We had 10,312 positive results notified in the 24 hours to 4 p.m. yesterday, which include just under 6,000 positive rapid antigen tests and just over 4,000 positive PCR tests. So we still are keeping our testing numbers high. And just to remind the whole community that if you're having trouble accessing a RAT and you need a test because you've got symptoms or because you've had an exposure to COVID, that those PCR testing clinics are still open and available across the state.
Thank you so much, Dr. Jan, for that update. We'll go straight to the questions here. And again, if you have any questions, please put them under the chat. We'll also try to put some links to some new multicultural, multilingual resources on COVID-19 for you. The question here, Minister Coure, is that with the international borders now open, as you mentioned, how is the government ensuring travelers and New South Wales residents are kept safe?
Well, that's a really good question, and I want to thank the media out there for that question. Look, at the end of the day, we're doing everything we can to make sure people are getting vaccinated, getting the booster shot. Of course, we're making sure that there are avenues in place to ensure that that everyone remains safe and stays safe. We've got rapid antigen testing kits out there in multicultural communities, and it's also worth to note that unvaccinated travellers would still need to apply for a travel exemption to come to Australia and undergo that hotel quarantine if they were granted permission to enter the country in the first place. All foreign visitors to Australia will have to show proof that they've received the full dose of the approved COVID-19 vaccine. Obviously, the New South Wales Government caps on quarantine for unvaccinated travellers will continue to apply.
Coure. A question here, Dr. Jan, about boosters, as the Minister was saying, and also how important is it to get the boosters now that for 16-year-olds it's available?
Look, I think what we have seen is we know that most young adults and older teenagers will probably not have a severe disease, but some will. And that's why it's particularly important, particularly in those who are age 16 and over. Either we've got the final years of school or final years of school and apprenticeships, really important times to be at school, and for the social development. And those vaccines will help reduce transmission in the school environment at home, and also will help protect people who may be more vulnerable to severe disease. But also, we do know that very rarely, but importantly, young people with no pre-existing conditions can get terrifically ill with COVID-19. And so it remains important to keep our kids up to date with their immunisation. And for COVID, that means getting the booster if they're over 16. And it's been 3 months since they had that last dose of vaccine.
Thank you, Dr. Jan. And I guess that the question, Minister Coure, for the students who are getting their boosters, but for teachers and how important it is to keep the schools safe.
Well, it certainly is. And we've rolled out, as we all know, we've rolled out rapid antigen test kits to parents with kids in primary school. And we've rolled that out over the last 2 weeks so that we can get school back together again. And as I've said before, you know, the best thing for a child is to be in front of the classroom. My child got his rapid antigen testing kits from his school last week or the week before, and is now back at school, which is great. We want to make sure that teachers as well get tested. We want to make sure that teachers ensure that teachers get that booster shot. As we all know, many of them, in fact, all of them now by now, have been vaccinated, fully vaccinated. And now, of course, we want to make sure that they get their booster shot when, of course, the timing is applicable to them.
Coure, we'll now go to parents of young children and babies. Will COVID-19 vaccine help to protect babies?
Yeah, it certainly does. So the first place it can help protect them is actually in the womb. And that's because if you get COVID when you're pregnant, you can have terrible complications for your baby. So the first place we're protecting them is before they're born. After the baby's been born, because mum's had some immunity from being vaccinated, that will carry on with the bub, and including if they're breastfeeding, they can potentially pass on some protection to baby that way. But of course, the other way is that if we're vaccinated as adults, we help protect our babies from being infected simply because we're less likely to transmit to smaller people, and that means that they'll be safer. So having as many people vaccinated around them, just like we do with whooping cough, really will help protect bub.
Thank you so much, Dr. Jan. Minister Coure, a question here is about now the international borders are open, and also what kind of support will be available for international students?
Look, that's a really, really good question. And that's a really, really good question. I mean, you know, unvaccinated people arriving from overseas are required, obviously, to take their mandatory quarantine, in a sort of a managed accommodation facility. My understanding is that, you know, there'll be help for those that are coming here. Mandatory quarantine is undertaken in hotels where you will be supported through your stay, and you'll be, as you know, charged for that fee for the hotel quarantine. Quarantine is managed by New South Wales Government in hotel quarantines right across Sydney, mostly in the CBD. And while you are in quarantine, there is support services that you can access for you to help, of course.
Thank you, Minister. Dr. Jan, a question about Omicron, of course, this variant, and is Omicron more likely to reinfect other than other variants?
So what we are seeing is people who had either COVID in the early days or even who had recently had Delta are able to become unwell with Omicron. And so we can't take the fact that we've had COVID in the past to suggest that we'll always be protected into the future. And so it's that people sometimes think, I've had COVID, I don't have to worry about being vaccinated. And what they're seeing is that the combination of both being vaccinated, and if you happen to have had COVID, or if you happen to have all your vaccinations, the best way of being protected. So even if you've had COVID before, still important to get vaccinated and still able to spread Omicron between yourself, your family and others. So we can't sort of say, I've already had COVID, it's already done with. We really do need to get vaccinated, and if we've been vaccinated, to get that booster dose in.
Thank you so much, Dr. Jan. And Minister Coure, a lot of the community members are getting COVID. What is the government doing in terms of getting information out? And I know that you are continuing to do these community education sessions.
Yeah, well, that's a really good question. And if I can just go back to the previous question, and I meant to mention that we launched a brand new purpose-built website so international students can easily find the information that they need in terms of getting vaccinated. And it's sort of an industry toolkit, if I can say, to assist educators, education providers, community organisations in terms of tailoring the information in terms of the vaccine and getting that out as well. And there's also that tailored website for international students with all the information that they need while they're back in Australia or here to study. Look, in terms of, translation and obviously getting that material translated, Multicultural New South Wales' team, and they're on this Zoom today, are working very closely with New South Wales Health and Department of Customer Service to get that important health messaging out there translated in many different multicultural communities. About 2 weeks ago, we saw a range of content and material, posters, online ads, fact sheets, social media tiles, and so forth, focusing on rapid antigen testing and the registration of that, what to do a rapid antigen test, action plan for people who test positive, and of course there's rapid antigen test and COVID-related advice there for residents in public housing, and of course, more importantly, information as well on the booster shots as well as part of our campaign moving forward. So there is a lot out there for multicultural communities and, more importantly as well, the multicultural media, because we can't do it without you to get the message out. Multicultural New South Wales has also established a weekly circular for multicultural communities, which includes all the relevant links relevant for COVID resources in language. So make sure you jump online, get those websites, get those emails, and get that information as well.
Thank you so much, Minister Coure. And we have something that's pop up from Russell Anderson from NEMBC Media, working with New South Wales Government, and there's a lot of resources coming out with audio resources in partnership with a lot of multicultural media. So we encourage you to please put on whatever you're doing for the community and add this to the chat so everyone can see. A question here from Bushra Al-Ubaidi. Are the visitors from the 21st of February allowed with or without the booster? Minister Coure and Dr. Jan.
Well, that's a really good question. I think they do need the booster, but I will refer to Dr. Jan if I can.
So my understanding is that's still being discussed at the national level as to what people would need. But of course, our recommendation, being people in New South Wales, would that be that please, whatever you can do, if you've got friends or family overseas, get the booster for their sake, wherever they are in the world, but also coming to Australia. We do know that a number of people have been infected with COVID on the flight from wherever they are in the world to Australia. So it will also help protect them, even if the COVID rates are low where they're coming from, just as they travel through the world. So definitely, we would certainly recommend that people would get the booster. And I think we will wait for the announcement from the Australian government who look after the border.
Thank you, Dr. Jan. And I guess a follow-up question for that is, when you are traveling, is it important that you get your booster?
Yeah, and I think that's something for all of us, that if we're choosing to go overseas or we're travelling in Australia even, the better protected we are, the less likely we are to become quite unwell when we're away from home. And quite unwell could be anything from needing hospital to just being completely miserable with a cough and feeling really unwell somewhere. So protecting ourselves before we travel, and in the coming months we'll also have the influenza vaccine available, will be really important so that we're not sick when we're away from home, because as we know, COVID can suddenly have a big surge, and where that happens when we're overseas, and if their health system comes under strain, then we may not be able to seek care for other things as well. So it behooves us to remain really aware of where we're travelling to, how that health system's coping more generally, because when we're on holiday, things can happen like broken legs off scooters or any other thing, but also to make sure that we've done everything we can to protect ourselves before we travel.
Thank you so much, Dr. Jan. Minister Coure, more and more people are going around, out and about, of course, to places. People are going to weddings, people are going to activities. How important is it for the community to still remain cautious, and also for businesses to keep everyone safe?
Look, it's a really good question, this, and I think it's really important that people remain safe. They follow the health advice. They follow the health advice that sometimes can change, every fortnight or so. It's important to make sure you and your family get that booster shot as well. I mean, this is not just about protecting yourself. It's about protecting your community as well. So we want to make sure, and that's why we've launched this campaign, to get as many people as possible vaccinated, and of course having that booster shot for that extra added defence from the strain.
Thank you, Minister. Dr. Jan, a question about and I've heard this many times, about how people, when they get the booster or they've had the second dose, how do they access information when they don't know if it's time for them to get the booster? Look,
the easiest way is if you've got a mobile phone where you can access apps, is to download your certificate. And so that's available through the Medicare Express app. New South Wales Health has recently put a post up on Facebook to help people with that. And that will tell you when you had your last dose of vaccine. And from that certificate, which is the immunisation certificate, you can look to see, is it been 3 months since I had that last dose? And if it's been 3 months or longer, it's time for you to get that booster. And if you are an immunocompromised member of the community who is recommended to have 3 doses as your primary course, if it's been 3 months since you had that 3rd dose as part of your primary course, there are people who've had significant cancer, who are on drugs for immune therapy, people who've had transplants, they may have been recommended to have 3 doses first up. Then when they get that, they have a look, and they should have their 4th dose 3 months later, and that 4th dose is available through New South Wales Health Clinics as well.
Thank you, Dr. Jan. And Minister Coure just mentioned about the action plans for people who have had COVID. What is the key steps or key tips that you have for people who are managing themselves at home with COVID?
Look, I think the first thing is, before we get COVID, is to be prepared to reach out to our social network and make sure that we know who can help us, go and get medicines or help us with food drop-offs or whatever. So activate our social network, and also, being good neighbours, making sure that we reach out to people to say, hey, if you get COVID, I'm here to help you. The second thing that we do is, if we're sick, is trying to isolate ourselves away from the rest of our family or friends, to try and be in a room by ourselves as much as we can, so that we reduce the chance that we'll infect other people with COVID. It's not true that just because somebody in the house has COVID that everyone's definitely going to get COVID. And so even if you've exposed people, I've heard people say, but I was sleeping in the same bed as my husband last night, that's fine. But if you can move away from your husband tonight, he may have a reduced chance of getting COVID from you. So it can be that cumulative dose of exposure that can cause more problems. So separating yourself aside. If you have symptoms, it's really important that you monitor those symptoms, and you can modify those symptoms with things like paracetamol or ibuprofen that you can get over the counter in the supermarket. There are some people, though, who are over 60 and who aren't vaccinated, people who have significant chronic health conditions, particularly a number of them, and people who are immunocompromised. And we'd really like you, if you have a RAT test, to register it with Service New South Wales, or a PCR, to work with that person to make sure that they reach into New South Wales Health or to their GP to make sure that, because they've got higher risk factors for having a poorer outcome from COVID, that we're there to help you. So please do reach into New South Wales Health. And of course, anyone of any age can wind up with a severe illness. So if you're in a circumstance where you're having trouble breathing, where you can't walk to the door without getting really out of breath and feeling out of sorts, or if the family member that you're looking after, when you go to talk to them, they're just not making sense, please do ring 000. The ambulance service will talk you through what's going on there, and will dispatch an ambulance if needed. So don't wait and see if the person gets better if they're already really out of breath and not breathing well.
Thank you so much, Dr. Jan. And another question from Boshra to Dr. Jan and Minister. When will the booster jab date or mean a proof of a booster vaccine be available through Medicare?
It's already available. So if you go in and have a look, you'll be able to see that you've actually had as many doses registered on the Australian Immunisation Register as necessary. So it's certainly already there. If for whatever reason you're missing that from your certificate, what you do need to do is talk to the person who provided you with the vaccination, and they can help make sure that you're registered that dose. So it's already available to you on your immunisation certificate.
Thank you, Dr. Jan. Minister Coure, these apps and services that are being available by New South Wales Government has been really essential during this COVID-19 pandemic.
Well, they certainly have. I mean, they're vital in making sure that, one, we get that message out. Two, people are using that to scan in and scan out the venues on a regular basis. I mean, that data is so important, particularly during the Delta strain. But more importantly, getting the information out to local residents and people right across New South Wales has been really important. Now that you, of course, can register your RAT test on the Service New South Wales app, also plays a massive part in ensuring that New South Wales Health is getting the data that it needs to combat this variant.
Thank you, Minister. And any updates that you'd like to add in terms of providing, when Dr. Jan had mentioned that a lot of people are at home and caring for themselves. I know that Multicultural New South Wales and the government are doing a lot in terms of providing packs for multicultural communities.
Look, absolutely. That's a really good comment and question there. I mean, what we've got through Multicultural New South Wales is, we have set out over $54 million in government grants to community groups and those groups are able to spend that money. I mean, I've obviously applied, but they're able to spend their money if successful on wellbeing packs, on translating materials, on food packs, on service and advice for their communities. I mean, at the end of the day, this pandemic, one thing that we could come out of this and say is that community groups have done an amazing job in making sure that their communities itself are safe and are following the health advice. And through the money that we've been able to provide through Multicultural New South Wales, we're able to get that information out to those community groups as quickly as possible so that they can, provide their community, their local members with the health advice, translated material, food hampers, wellbeing packs.
Thank you, Minister Coure. And Dr. Jan, we have been working a lot with New South Wales Health and Multicultural Health Communication Service has been working a lot with doctors who speak different languages and delivering these messages. What do you say to these, the unconditional work that they're doing?
Look, I think one of the things is, a word I often hear is tireless. Now, I actually know that a lot of the people who've been doing this work are exhausted, but yet they still front up. And when we ask them to communicate to community in language, because as respected leaders, as respected physicians, they're willing to do that. It's just remarkable. And so all of those videos and all of that material is available on the New South Wales Health website. And so I'd really encourage you to take the time to share those materials with your community, simply because it makes a big difference. And we also have heard loud and clear from a number of community groups that written language is not the way to communicate with us. Please give us the messages in language we understand by people we trust. And so that's why we've gone out of our way to work with those community leaders who've, filmed things on iPhones with very short notice and have just been available to their communities over and over again. So just to really acknowledge the hard work of so many people in the community to try and get the message out there, but just to thank people whenever they do pick up these new messages. And some of the new messages are about how to do a rapid antigen test, how to make sure that you understand what a positive result looks like, because it is a bit tricky with those positive results, because we're sort of used to tests that have a really clear, hard line. But one of the things with the rapid antigen tests that we've all learned is having one solid line for the control line, and then having a bit of a sparkle or just a little drizzle of stuff on the second line is a positive test result. And so all of those things that we're spreading those messages in the community to help people keep safe and understand the tests that they're doing, really amazing. And so much work, I think, just in the last week or so, with so many more videos available, and please share them.
Yes, that's right. Dr. Jan, there's managing for COVID at home, managing COVID at home. There's resources in different languages by doctors and general practitioners in language, and also the rapid antigen test in several languages. So that's available if you visit newsouthwales.gov.au and New South Wales Health website. So, well, that's it for us today, but would like to ask Minister Coure for some last remarks and comments before you go.
Well, thank you very much. Again, thank you to all the media and representatives from Multicultural New South Wales, and of course the Department of Health as well. Multicultural media plays such a huge role in making sure that the latest information from government, let it be health advice or just general advice, is out there in the communities as quickly as possible. If I can just leave you on this, last week we announced a significant package for small businesses with the safety support. Small businesses can apply for up to $1,000 rebate for safe workplaces, double the rebate support for per application from $500 to $1,000. This includes COVID safety equipment like PPE equipment, hand sanitizer, and so forth. So there is a lot of business support, small business support in this space, not just in regards to PPE equipment, but also, you know, landlords and other small business advice and support. So jump on the Service New South Wales website, where all of that information is uploaded on a regular basis, where your community, people in small business, will be able to look at that information and then apply where necessary.
Thank you so much, Minister Coure, and for your commitment to always announce these grants, and also for being here weekly for the multicultural media. And Dr. Jan, any last words?
Just to say it's a beautiful day in Sydney today, and so it's great for a COVID-safe outdoor gathering. So I hope everyone has a lovely evening and enjoys the sunshine.
Thanks so much, Dr. Jan. And on behalf of Minister Coure and Dr. Jan and Ministry of Health, the New South Wales Multicultural Health Communication Service, and Multicultural New South Wales, we want to thank you for joining us. For any recordings of these sessions and the weekly online cold pressers, please go onto the New South Wales Multicultural Health Communication Service website. Please take care, stay safe, and be kind to one another. We'll see you again next week.